So part 2 of the pharmacist manual overview for controlled substances. So distributing, how prescription must be written in ink, pencil that can be erased, it must be typed, manually signed. The prescriber must write and sign the C2. In an emergency, you can phone in a C2, but prescriber must send the written prescription in 7 days, and note that it's authorization for the emergency refill. They say 3 through 5 can be written, verbal, or electronic. So going over to your DEA numbers that is required on the controlled prescription, it's a code consisting of 2 letters and 7 numbers. So the first letter is going to be A, B, or F. It could be an X if they're data waved. If they're mid-level, it could be an M. Distributor should begin with a P or an R. The second letter is the first letter of the registrant's last name. So how to validate a DEA number besides the letters? So for the 7, you add the odd occurring numbers, so the first, third, and fifth, to get a number after you add them together, so the sum, and then get the sum of the even numbers, 2, 4, and 6, multiply the even numbers by 2. So even by 2. Then add the answers from the sum of the odd and the sum of the even by 2, add the sums together, and you get a number, and the last digit of that number should be the 7th digit of the DEA number. It should match, and that's how you validate a DEA number. So tamper-resistant prescription pads must be designed to prevent unauthorized copying of a completed or blank prescription pad, ensure or modification of information written on the prescription pad by the prescriber, and the use of counterfeit prescription pads in order to be considered tamper-resistant. So they all have to be designed to prevent this, your prescription pads. Now, all prescriptions for any controlled substances, according to the DEA, must have a date issued with the prescriber's signature on same date, full patient name and address, drug name, strength, dosage form, quantity prescribed, the signature, the SIG, and name, the SIG, so like directions for use, and name, address, and DEA number of the prescriber, with no fraudulent info added, no required info left out, no dispensing of controls with invalid or incomplete prescriptions, no dispensing with fake, revoked, suspended, expired, deceased prescriber DEA can't dispense, no dispensing if the DEA does not match signing prescriber the DEA number. So C2 is changed the same as a C3 or 4. So you can pretty much change everything but the drug name and the patient's name kind of thing. So, and you can change the patient address upon verification, and you can add or change the dosage form, strength, quantity, directions for use, and the issue date with an oral talk for C3 through 5. But yeah, you can't change the patient's name, the drug's name, you can switch to a generic, and you can't change the prescriber's signature. So if it's a C2, they're going to have to get a whole new prescription for that. For Alabama, they actually say you can't change the fill by date though, or the do not fill before date is the only difference Alabama-wise, so you can't change that on a controlled prescription. So forwarding controlled drugs for the MPJE, if you received it electronically, you can forward. If it's not the original fill, but a refill, yes, you can forward. If it's a hard copy stored to the patient, no, you would give the hard copy back to the patient. So any e-scribed unfilled original controls, including the C2, can be forwarded from one DEA registered retail pharmacy to another DEA registered pharmacy via e-scribe. This can only be done one time, unless they share a system. So C3 through 4 refill may be forwarded by e-scribe or by phone, and C through 5, the original handwritten prescription may be filled or hard copy returned to the patient. So in Alabama, any e-scribe content, including the C2, may be forwarded to other pharmacy if through an e-scribe system. So definitely check your state on that. I was thinking it was federal, but I would say it's just Alabama that I found that. So dispensing C2 prescriptions. The written prescription, C2s do not expire. They cannot be refilled, except for there are emergency situations, but emergency 2 now in Alabama is not for the general patient population, whereas in federal it is. So in Alabama it's only for long-term care, hospice. So emergency C2 prescriptions, the quantity is limited to the amount necessary to treat the moment. In Alabama, that's 72 hours, and you have 72 hours partial fill wise to fill that, and that's most places. Prescription immediately reduced to writing to contain all the required information except the physician's signature. Pharmacist must confirm the prescriber. Obtain a written prescription within 7 days with the wording authorization for emergency dispensing and the date of oral order must appear in the prescription. And the DEA has interpreted oral to include a fax for the situation if allowed by state, and I believe Alabama does. And it's typically okay for the general population, but not in Alabama. Only special populations in Alabama. So fax or e-scribed C2 prescriptions, there's only 3 situations where fax may serve as the original, which is when it's compounded for direct administration, long-term care facility patients, or hospice patients. You can get a fax and prepare the C2, but you need the written prescription to actually give it to the patient. So partial filling of a C2 prescription is allowed under CARA, the 2016 Act. Partial fill, if the partial fill is requested by the patient or practitioner that wrote the prescription, you now have more time. You have a 30-day availability to partial fill it. So total quantity dispensed for all partial fillings does not exceed the total prescribed, and the total prescribed cannot be more than 90-day supply. And so this has to be filled within 30 days of the written date. Now, if you don't have it in stock and you're the pharmacist, you actually can only have 72 hours unless the patient fills. This is still like in the air, and they're working on, most your states are going to work on changing that. But I would imagine if the MPJE said something like, you don't have this medication, you only have 4 in the prescriptions for 7, then you'd have 72 hours to fill that, not 30 days, since it's your fault. But if they say that the patient asked to only get 4 of the 7, then you have 30 days. So partial filling of C2 prescriptions in long-term care facilities is allowed for individual dosage units no longer than 60 days from the date of issue. So partial filling of C2s for special population, including terminal illness, is no longer than 60 days. So instead of 30 of 60, and that's the longest. The total quantity may not exceed the quantity prescribed. Of course, pharmacists must keep a record, date, quantity dispensed, remaining quantity authorized. So multiple C2 prescriptions, same drug, same patient, same day. Each drug and strength must be issued on separate prescription papers for C2. Each prescription must have a date of assurance. There's no post dating, so it's the date that was written and then the fill by date. The quantity cannot exceed a 90-day supply for any one prescription, and the practitioner provide or write instructions for the date to fill. Dispensing of C3, 4, and 5 controlled substances, written, fax, or oral. Written and fax prescriptions must contain prescriber's signature, a wet signature. If not, you have to call and treat it as an oral prescription. Practitioners may administer or dispense C3, 4, and 5 controlled substances without a prescription. E-prescriptions are to be treated as oral prescriptions. C5 drugs do not have a federal expiration, neither do they have an Alabama one, and they're refilled as authorized by the prescriber. So refills on schedules 3 and 4, no more than 5 times, and not more than the 6-month period for one prescription. Automated records may be kept versus writing on prescriptions. Automated records must verify dated and signed by the pharmacist, or if it's a hard copy, printed out, if it's automated and within 72 hours. Records must be maintained for a minimum of 2 years. And of course, if you can't get a hard copy, you can have a logbook where you sign for all of the prescriptions that day, verifying. The computerized system has to be able to do the printout, include name of prescriber, address of the patient, name of the patient, quantity dispensed, the date of the prescribing each refill, name or ID code for dispensing pharmacist, number of original prescription orders. If it was maintained in a central location, you would have to provide that within 48 hours. And you can have the auxiliary system. So partial filling of a C3 and 4, it is permitted. Partial fills are recorded in the same manner as a refill, but they are not treated as a refill. But so the total does not exceed the total prescribed. No dispensing after 6 months. Alright, so our next section, section 10, is about labeling. So labeling of C2, 3, 4, and 5 prescriptions. They need the date of filling, the pharmacy name and address, the serial number of the prescription, name of the patient, name of the prescriber. In this case, you don't need the prescriber's address. Directions for use and cautionary statements, if any. The caution federal for 3, 4, 5 And 2, caution, federal law prohibits the transfer of the drug of any person other than the person for whom it is prescribed. So C2s also don't need the address of the prescriber. It's not in the pharmacy manual, so maybe your state might require it though. Transferring of prescription information is permitted for C3, 4, and 5. It's, of course, a one-time if your state allows, and this is not included in between stores, so we kind of talked about that. If you're the transferring pharmacist, you write void on the face of the prescription, name, address, DEA registration of the pharmacy where it's being transferred, name of the pharmacist receiving, date of transfer, name of pharmacist making transfer. So if you've done copies at a retail chain, you kind of get what this is like. The receiving pharmacist needs everything from the original prescription and basically what they've done with it already. So they write transfer on the prescription, they write date of the original prescription, original number of refills, refills remaining, date of original dispensing, date and location of previous refills, transferring pharmacist's name, address, and DEA number, original prescription number, name of the transferring pharmacist, pharmacy name, address, DEA number, prescription number for which the prescription was originally filled, and both transferring and receiving pharmacists must keep these records for at least 2 years. So on all these rules, you can kind of see why you can only transfer this one time unless you share the same system like multiple Walgreens or something. So return of controlled substances for disposal. To become a collector, you actually have to register with the DEA. And we will talk about central filling from the pharmacy manual in the next part.